Hola a todos, bienvenidos nuevamente al primer día del Congreso Nacional del Colegio Mexicano de Traumatología y Ortopedia. Y esta es nuestra tercera entrevista del día, muy especial porque estoy con mi amigo y cofundador y presidente actual del Congreso, el doctor Pablo Arturo García Zárate. Hola, amigo.
Hola amigos, muchas gracias por la invitación.
Y tenemos un invitado muy especial desde Estados Unidos, el doctor William Ciccione.
Hello, thanks for having
Welcome,
me.
doctor.
Thank you so much.
Welcome to Guadalajara, and you have to know this is the first time Dr. William Ciccione is in Mexico. He tried tacos.
Really?
Yeah, he tried tacos with salsa yesterday. How was it? How was the experience?
I tried to avoid the salsa as best as possible.
Oh.
A little too spicy, but very good. It was
Very
very,
good?
Yes, very good.
And doctor, what characteristics do you look in your fellows in addition to academic preparation?
So I think for fellowships, at least in the United States anyway, we look for people who are interested in working and are interested in a specific topic that they want to pursue for either for practice or for research. So, but I think one of the most important things is just having the interest in being there and wanting to progress in your profession.
¿Alguna pregunta, amigo?
Oh yeah, and how many years are your fellowship with you? 1, 2 years?
So they're one-year fellowships.
1 year fellowship.
1 year?
Yeah.
It's in Corner Store?
Yes, in Denver, Colorado.
Denver, Colorado.
Yes, Orthopedic Centers of Colorado, correct.
Okay.
Yes.
And talking about shoulder surgery, it's a shoulder arthroscopy and replacement surgery, knee surgery, and what else topics and
So I did a sports medicine fellowship.
sports medicine?
So the majority of my practice, however, is shoulder surgery, shoulder replacement, shoulder arthroscopy, and instability surgery, occasional knee surgeries.
Occasionally.
Yeah.
Okay.
Just the cases you wanted, isn't it?
Just the case. I've got partners who are much better at those.
Yeah,
They handle those.
What cases? Knee cases? What pathologies?
That I will treat.
In knee.
Oh yeah, so we do ACL reconstructions,
Okay.
patellar instabilities, cartilage surgeries, those type of things.
And that's all. In knee.
Yeah, well, in knee, that's correct. Yeah,
But shoulder.
yeah, I do all shoulder, correct. Yeah.
In relation with your fellowships, how deep they involve in the case? They have to prepare the patient. They make the physical examination, the MRIs. How is it?
Yes. So normally with the fellows, they do clinical evaluations in the office,
Okay.
and then we have a conference to discuss the upcoming surgeries,
Okay.
and they present how they would perform the surgery, and then I'm there to help.
And in the surgery, they start to involve and use.
And they're just watching.
No, they use their hands. Yeah. So they're working.
And how many surgeries are performed weekly?
So I do between 10 and 15 surgeries
10 and
a week.
15.
A week. So it's a good year here in Mexico.
And what can I do to apply as one of your fellows?
Well, I mean, we're in the United States, so there's extra hurdles to get there. I mean, I think that we will be more than willing to have fellows come and observe. We can do that. To scrub in, you'd have to be registered in the United States as a physician. That probably requires a lot of money and cost. But to come up and observe for a few days, we'd be happy to have anyone.
Okay. Porque uno piensa que es fácil. It seems it's easier, but no.
No, but I think there are good opportunities. Last year I was in Boston and I make something like that, and you take a lot of tips and tricks from the doctors you're going to watch, and I think it's a great opportunity to
And
do.
as a fellow, what are my activities?
Well, if you were from Mexico coming up to the United States, you would help us in clinic. You would follow me in clinic, basically. We could have lectures, opportunities to discuss the cases, and then you could come in and observe. You can't operate, but you could come in and observe.
Yeah, which is great for learning, no?
Yeah.
Yeah.
What do you think of the current landscape of the AI applied to education?
I think AI has an important role in upcoming education. I mean, I think there's dangers in AI as well. We're looking at using it more to help with clinical notes in the office. I don't know if you do that down here or not, where you can interview the patient, right, and have it generate your notes. It's going to make you more efficient, which I think is good, and allow you to focus more on the clinical aspects of care than on the paperwork.
Yeah, and you can focus on the patient.
Yes,
which is much better.
And cons?
I think the main issues with AI are loss of the work that it takes to learn something and actually know your product and your passion for patient care, and being too reliant on AI as a crutch.
Exactly. And what do you do to maintain your physical, mental health, and mojo?
Well, for whatever that's worth, yes. So I'm quite active. I do in Colorado. We have skiing, we have mountain biking. My family's very active in outdoor activities. We do a lot of those type of things as well. I enjoy the educational side of things as well. I enjoy coming down to your meeting. Very honored to be here at your meeting today.
It's an honor for us.
Yeah, this is a wonderful experience. So this is kind of everything for me.
Okay. And can you share with us a tip for speaking in front of many people?
So I think when you're designing a talk or a lecture, scientific lecture, you have to know who your audience is. So who's going to be in your audience and what do they want to learn? And then I basically look at what I would want to learn and what I would want to hear the speaker saying, where I find some of the shortcomings or the deficits are in procedures that I do and things that I think people would want to know. And I design talks around that.
Good.
I'm speechless. I'm thinking too many things, but I think it's great that those tips and tricks are helps a lot. But have you ever been nervous when you go to speak, and what do you do?
Oh yeah, every time.
Every time?
Every time. Yeah, that just gets your brain working better.
Exactly.
That's all motivational.
Have you seen something like a TED Talk that helps you out to improve your how you stand, your volume, your pauses? Have you tried something like that, or?
Yeah, I think to that point, I enjoy watching other people talk as well to see how they navigate through their talks. Okay. And there are some
how
people,
they do it. Oh.
Yeah, there are some people who are very fluid, right, and can just move right through and kind of do it. I'm not necessarily like that, but I think that you can watch those people, and you have to learn how to use your words to move through the
surfing the talk.
To be able to get your point across, but yet make it interesting for the audience.
That's great. And I know for a personal experience that you are very involved in education in ANA, which this year ANA is the association we invite as an association in Mexico. What can you tell us about that training and all the place of the training, because it's amazing, that place.
Yeah, so the Arthroscopy Association of North America is a association that's interested in promoting patient safety.
Okay.
In a sense where, or in implying minimally invasive surgery or arthroscopic surgery. And most of those done in an outpatient setting as well. So that's kind of one of the main goals and I'm very honored to be involved with that. And I know you've been helping out a lot with that as well.
We love to. We love to be involved with that.
It's a great society. We use the Orthopedic Learning Center in Chicago for a lot of our courses, which is a state-of-the-art training center with over 50 stations for wet labs and cadaveric surgeries. But in addition to that, we have a lot of industrial company support, where, as you know, you can use any type of implant you want to use, practice anything you want to do. It's a great area for learning, and it's one of the, I would say it's one of the highlights of the Arthroscopy Association.
I think it's a fast track of learning. I mean, if you have a need to learn something, if you go one of these courses, you take just one weekend. We have a straight flights from Mexico, any part of Mexico to Chicago. You take one train, and that's it. That's all you need, and you learn whatever you want to learn in arthroscopy.
And Pablo, as you know, for those who are interested in educational opportunities, ANA is also very open to advancing people who are interested, and so that you get to come in and teach yourself. So you can help us with Spanish.
Yeah, exactly. Yeah.
Come up,
we have done that. We have done that, and it's very. It's a great experience because you go with expectations and you are nervous because you don't know if we speak English or how we're going to help. And life gives you surprises because sometimes we've been too able to help people and share the knowledge.
Great help.
Yeah.
Great help. Yes.
Sí. Sí, dudas que eres capaz, ¿no?
Yeah,
you,
yeah, yeah.
You think you're not able?
Yeah, just you go with that doubt that if I'm going to teach him something and you see, you can teach something, no?
Yeah, you also learn something too. I mean, when you're at those courses,
You learn
right?
more than
Oh, yeah.
those
As
guys.
a teacher, as a
yeah,
professor.
because a teacher, you have the opportunity to talk with these guys, and
Yeah.
they're the directors of the course. And for example, Dr. Ciccione go and give you 2 tricks, and that trick helps you out more. Or Dr. Fadale goes and tells you something new trick, and this for the learner and for the teacher is great.
Yeah, there's nothing better than experience for teaching. We've all done the same. We've all had the same problems. It's
Yeah.
just a matter of how you work through them.
I know.
It's when you're finished to learn, no? When you're a professor,
I think
a
when
master.
you're teaching is when you start realizing and believe that you can do something to help people, and you sharing that knowledge to someone is I mean, I don't know in the word in English, but you
El
trasciendes.
pináculo.
Yeah, you're in the top, you're in the peak because
But it's very gratifying to help someone else, especially be able to help some other surgeon help their patients better.
Yeah.
To make them a better surgeon so that they're able to treat the patients in their community better.
yeah, and it's amazing because some of the residents they ask you for your Instagram or your phone, and 2 or 3 months later they get in touch. Doctor, I did this because you told me how to do it, and this. I know it's something you can buy it.
Yeah, Pablo's been very helpful in our foundations courses. We have courses for just the residents. So residents early in training to learn how to do arthroscopy, because arthroscopy is a lot of motor control and how you position the camera in your hands. So it takes a lot of time to be able to do that. So Pablo was very helpful with us when we have those, and we have a lot of residents come in and we're able to have them maybe learn something by the end of the course.
Ya te presumieron mucho.
I know. But
In addition to shoulder surgery, you have another passion?
Wow. My family is my other passion. You know, I have a wife and 3 kids. They're a little older, but we spend lots of time and that keeps me in my baseline. Keeps me organized, I should say.
It's hard how to keep the baseline.
and how do you handle that?
Yeah. I mean, I think, you know, as you get, I mean, I'm further along in practice now. I think it's easier now than when I was younger. You're younger, you've got other concerns, right? You've got to be busy, you have to provide, but as you get older, you can start enjoying more of the things that you worked for to begin with. So in this point in my career anyway, we're able to do teaching, we have some experience to do things, so I enjoy that, and I enjoy these types of settings.
And you have a travel ritual or something when you go to another country?
I wish I had a better one, that's for sure. I'm very apprehensive about traveling, especially here, but
Really?
Well, anywhere outside of the, any international, just because, especially if you have responsibilities, I don't want to let Pablo down because he'll come get me so we want to make sure that everything works okay, and especially with the computer things, and just to make sure that the talk's okay. And plus, I want to make sure we do a good job for what you expect here at this such a great conference.
Thank you.
No, but we're very happy to have you here. We're totally honored, especially for me, because not everybody knows, but my first teacher in arthroscopy in ANA was Dr. Ciccione, and he teaches a lot, and it was a great experience. So I really recommend it, that if you have the time and the money and the willing to learn, you should try these courses, because they're really worth it. Every dollar you spend in that, every minute, you will come back home with a lot much better of your practice.
Yeah, you'll leave the course exhausted, but you have learned a lot.
Yeah, exactly. Yeah. Well,
Did
you go? Yeah.
Sí, es que esta plática, entrevista.
Yeah, we can go eating and be talking like for hours. But we want to thank you first for coming. I know it's an effort because you leave your practice, your family, everything, but we are very glad to have you here. I recommend everybody that be at the ceremony, because Dr. Ciccione is gonna share some words with us, and it's going to be very emotional. And we're very glad to have you here.
Nervous?
Thank you.
Yeah, a little nervous. Gracias.
Gracias,
Gracias.
gracias
Gracias
a
a
usted,
usted.
doctor Ciccione. Y somos Ortoradio. Este es el 70º Congreso Nacional de Ortopedia, el mejor y más grande congreso
Y por
que
primera
hemos hecho.
vez en Guadalajara.
Por primera vez en Guadalajara, y tenemos muchos invitados. Va esto a estar padrísimo. Acuérdense que son 5 días, 35, ¿no? ¿Qué?
35 puntos y acuérdense que hay puntos adicionales con ciertos talleres. Chequen el video en redes.
Aquí los esperamos en Ortoradio. Muchas gracias. Gracias.
Thank you. Thank you.